The Education Channel and the Naples Alliance for Children are pleased to present a special TV program designed to offer strategies for effective parenting. The show features child development experts and it spotlights important topics parents may be dealing with. Now, here's Myra Shapiro.
Welcome. Naples Alliance provides help and information on issues here in Collier County and beyond. Today we're looking at the issue of mental health. It's nobody's fault. I have with me two experts here from Collier County who deal with mental health issues. I'll say day and night, because I'm sure when you get home you're still thinking about it. I have Van, I'm going to give the full name, L. Van Heilman, and he is a coordinator of psychological services, Section 504 ADA, my gosh, Section 5, compliance officer with the Collier County Public Schools. And we'll find more about what Van does as we go along. My other guest is Donna Charbonneau, and she is with NAMI of Collier County, which is the National Alliance for Mental Illness. On mental illness. And she is their HUGS program manager. Wow. I welcome you both here, and we'll get right started in talking about children's mental health. Everyone knows what a child needs physically, or should know. They need food, they need clothing, they need shelter, they need a good environment. But mental health, I just wonder, does everyone know what mental health is and what the needs are in mental health? Is there a food they need? So let's first go into, Donna, what is your definition? What is mental health?
Mental health is similar to physical health in the sense that just like the heart could get sick, just like the blood could get sick, the brain could get sick as well. And so there's no difference except that it's not as easy to see. So if a child or adult is struggling with their mental wellness, it's harder to identify. There's a stigma sometimes attached to it, so it's more difficult for people to sometimes get the treatment and the support that they need. And that's what we're here for, is to help destigmatize and support children and families.
And Van, what is your definition? Building on maybe what Donna said.
I do agree with that. Good mental health to me, though, is characterized by children who function well in school academically, socially. They tend to have good health, they sleep well, get along with the ups and downs of life with coping skills.
And now we titled this, It's Nobody's Fault. When someone has an accident, okay, it's someone's fault. They left the water running in the bathtub and the kid drowns. Is it someone is always responsible for the child's mental health if they have poor mental health?
Well, is somebody responsible for a child that has diabetes or that has a broken leg or that has a different illness? So it's no different than a physical illness. It is nobody's fault. It's important for the family to know that, and to know that there's support to help them in treating it, in learning how to work best with their child. So I really feel strongly that it is nobody's fault, and sometimes I think that parents are blamed for their parenting rather than for understanding that the child has a difficulty that needs extra attention.
And Van, just what you are with the public schools,
Correct.
You are coordinator of psychological services. Just for those people out there who don't know, just what does the school provide and what do you do? In just a few, not you could take up a
Yeah.
whole program with this, but
Right.
just give us an idea.
Well, I coordinate the services for the district, and we currently have 22 psychologists that I supervise, and we have a wide array of services that we provide. As you noted in my title there, I also coordinate Section 504, and I'm the district school neuropsychologist.
What is 504?
Section 504 is an anti-discrimination law that says that we must provide equal access to all students regardless of any disabilities, access to our programs, any services, our facilities, that kind of thing.
Let me just, this I'm going off a little bit, but if a child needs a service, the parent can't afford to provide the service, or maybe there's no one around to do the service, where does the parent do? How do they find help?
Hopefully the parent will come to us and let us know what concerns the parent has, so we then can begin looking at the needs of the students. And some students are served very well with accommodations provided under Section 504, or they may need more intensive services that would eventually lead to an IEP. But we certainly
And an IEP is?
an individual educational plan, and we speak jargon. And of course we would be doing a number of interventions prior to getting to that individual educational plan.
Okay, and we'll get into that a little bit more in detail in the second half of the show. And I know that you do go use some of the community resources also, which is one of them, I believe, is the HUGS program. And Donna, just the HUGS program, what do you do if you get a referral from the schools?
The HUGS program, first of all, stands for Health Under Guided Systems, and it's a program that's funded by the Naples Children in Education Foundation. So the services that we provide within our program are free of charge for families. And what we do is we offer screenings for social, emotional, and mental health questions. And then if the screening indicates a need, we provide a clinical assessment for the family. It's a one-time assessment. The clinician will meet with the family and the child and then write a report with recommendations for services if there are any. Everything that we do is voluntary for the family, and then we have system navigators and family support liaisons to help support the family through the referral process.
And in the second half of the show, I think we're going to take a child through the system and just see how they are handled. Now, getting back to the needs of a child, and when does that need start? Van, when do you feel, what exactly, as a parent, they have a newborn, they come home from the hospital with all the joys, and this is, we hope, and they have this new baby to deal with. Just when does mental health concerns start? When do the needs start, and just what are they?
Mental health concerns can start at birth. And often our pediatricians and medical people are very adept at picking up those kinds of things. Often students are identified as having mental health difficulties when they come to school. Otherwise, we are an organization that ends up identifying a number of students with mental health issues. So.
And just what are those issues? You hear now in the news someone is shooting someone, they say, oh yes, they have mental health issues. Did these start early on? Just how would a parent, what do you look for?
Well, I have to put a plug in for a video that's online. If parents click on the website, Parents, there is a mental health video that lists symptoms of mental illness or mental health problems beginning in early childhood, and it's broken down by age levels of students. But parents begin to notice children at home showing some of the signs of stress, difficulties eating, problems with sleeping, variable changes in moods, that sort of thing with young children.
So if a child is crying a lot, should the parent get really upset?
It depends. What we look for too is sudden changes in moods and behaviors. If this is a child that's being easygoing and generally happy and suddenly begins crying a lot, that would be a concern.
Okay, so it's just like with a physical illness that if something happens suddenly that the child
Exactly.
hasn't had. And what can you add to that, Donna? Do you have some red flags that you can think of?
I think for young children, it could be something even like a speech delay, that a child can have a speech delay, and that could lead to aggressive behavior because they can't speak about what they need or what they want, and they're frustrated. So even something as a speech delay could lead to some mental health difficulties for a child, and then they could be in a daycare setting, they could be in trouble a lot, they could feel like they're bad all the time. So even something as small or what is thought of as being small as having trouble with speech could be really significant in a child's mental health.
So then, say a child is in pre-K, in early childhood education, if a parent notices some things where the child is acting up, that they should look into it and see maybe there's a matter of a relationship with a teacher or something is happening with the children. And also, as Van, you said that the pediatricians pick up, which brings up the parents should get their children checked and know if there is done, if there's something, they wax in their ear and they can't hear at all, they're gonna maybe start acting up. Now, where do you see the parents come into this process? You're talking the schools can identify, they have fiddlers is out there, there are different things. You can call Naples Alliance for Children or the schools or Hugs and get some information where to go. But the parent themselves, parents are the first teachers, we all say this, and we're also saying parents are not responsible, it's not their fault. But where's that fine line? What should parents be doing, Van?
They should be actually, parents initiate the process many times by indicating to us that there are concerns. But family doctors, pediatricians are often the first line, as I mentioned. But as soon as they are aware of some kind of problem that's out of the ordinary, they should contact us, contact the teacher. All of our schools have problem-solving teams that work to identify problems and interventions.
And if they can't, they can call Hugs. What other places would they get their pediatrician probably can give referral. You have, you as the director of the Hugs program, you have places where they can refer to. I'm sure the school does too.
We do.
Yes. The first step would be we have a clinician that would do an assessment and then have recommendations for referrals for the family, and then we support them through that referral process.
And what is the first step for a parent? They say, oh, my child is really driving me crazy and driving everyone else crazy. What's the first step they should do? If they're not in school.
If they're not in school, I would recommend that they look at our community resources. We have a directory. We have David Lawrence Center. We have the Hugs program, plus a number of other providers out there.
So even if the child is not with you at NAMI, with you at the schools, you can give them a way to go.
Absolutely.
And you can also call Naples Alliance for Children, which will
Yes.
probably refer you to one of them and to the others. And we're going to follow a child in the next segment. And so hang around and we'll be back.
The Naples Alliance for Children program will return.
Are you concerned about your child and don't know where to turn? Naples Alliance for Children offers information and free referral services for Collier County children and families. Are you concerned about your child's progress in school, your child's behavior, physical growth, social and emotional development? Are you concerned about intergenerational issues? Contact Naples Alliance for Children, www.napleschild.org, or call 239-649-5260.
The Education Channel, always giving you a close-up look at our students. Education Channel is your window to education. Now back to the Naples Alliance for Children TV show.
Welcome back as Naples Alliance for Children looks into children's mental health. It's nobody's fault. I think that's the name of the show. But anyway, we are looking at mental health, and in the first half, we promised that our guests would, Van Heilman from the public schools and Donna Charbonneau from NAMI's HUG program. We're going to take a child through the process of how they can get help, or how a parent can get help for a child. Okay, I'm going to set the stage. Parent has a child, maybe preschool, maybe school age, just the child. Gets all these reports on how horrible this child is. This child is really a terror. Okay, first step, Van, what should the parent do?
The parent should let us know what the parent is seeing at home and come to us and meet with our problem-solving team so we can start then in planning out some interventions for this child.
Now, if the child is not in the public schools, there are many scenarios. It could be in a preschool, could be in a private school, could be homeschooled. Where can they go? Either one of you.
Well, they could come to the HUGS program and fill out a social and emotional screening for the child, and that there are questions such as, can your child calm down after exciting activities? How does your child transition from eating to playing? Those kinds of things. Do you enjoy mealtime together? So they can fill out a screening, and then if the results of the screening or the parents have enough concerns to indicate, they would have an assessment from one of our clinicians, and we have several clinicians with different backgrounds, expertise. The parents can choose which clinician.
Now, we're going to just stop there,
Okay.
and then we're going to come back to the assessments.
Okay.
And then if they're in the public schools, you have the process all set up. Who do they call? Do they call their principal? Do they call the teacher? Where do they start?
Usually the school counselor's the first line of contact for concerns like that.
All right. So, and parents should not hesitate at all to call.
Absolutely, yeah.
Now, and I'm just because I just want to get this in. This doesn't. We're talking about a young child maybe now, but this could be a high school child. It could be a middle school child. Middle school is a horror sometimes for kids. So, this would work any place.
Absolutely.
Okay. Now, first step is you refer. You do testing. Is that the first
Not
step?
necessarily.
Okay.
First step is we have behavior management programs for all of our students in the classroom. The first step, once we identify a student that needs more than that, is to begin planning some interventions just for that child. In the case of a behavior problem, the teacher may develop a behavior plan for the student, monitor it, collect data, actually create a graph, and try that out. If that doesn't seem to be working, the next step may be more intensive, involving counseling services and so forth. Again, we collect data and look at the progress. Eventually, we may decide to do a comprehensive psychological evaluation, and of course, the parents are involved at every step of that way.
So they know, they get the reports, they get everything going. And probably I should enter in, because we kind of talked about it at the first, have a physical exam for your child with the doctor to make sure that they can see, they can hear, they don't have any physical problems that would interfere. And Donna, this is, now if you get a child who is not, the public schools does a good job of taking these through. Are you getting kids who are not in the public schools, or are they mainly referral from the public schools?
We get referrals from the public schools quite a bit, but we also get referrals from other schools, private schools, as well as from parents that have concerns, as well as from other partner organizations that we work with.
And Van, who else do you refer to from the schools, or if someone called that wasn't able to get, I know David Lawrence does some of the screening.
Our website has a list of resources in this county, and also national resources as well. So we sit down with the parents and talk about what's available and what their particular needs are.
And that also, Naples, I'm doing a plug for Naples Alliance for Children. We have a resource directory that is also on the website, and you can just put in a keyword, mental health children, and you'll get a list of most of the places to go. But I think probably both of you agree that the places do something. Don't just, there are people out there, and if the first person doesn't work, go to the second person. All right, now let's get back to the screening. Screening can be really scary, I would think. I mean, is that, oh my gosh, they're going to screen my kid, and what are they going to ask her or him? What is a screening?
Well, I'd like to talk about that because when the HUGS program first started, which was about 4.5 years ago, we thought we were going to have to offer incentives for the parents to fill out the screenings. We would go to out in the community. We have an RV that we go with, and we thought we were going to have to provide some type of an incentive for the parents. And actually, that wasn't necessary. And the parents just want to know, how is my child doing? Are they okay? And they wanted to fill out the screenings. So we haven't seen the resistance to the screenings that we initially thought might be a difficult thing for parents to do.
And the kids are not, the kids are calm when they're even in the schools. You find this in the schools too?
Yes.
That screenings are not a scary sort of a
Absolutely
thing
not.
for them.
They are not.
Okay, now they've had the screening after in the school, they've had some other intervention in the classroom and all, then they get the screening. Now, where do you go from the screening? Van, would you start?
Well, again, if we're at that intensive level of intervention of individualized behavior plan, counseling services, and those interventions are not working, our next step would be to do not a screening, but a comprehensive psychological evaluation.
What is that?
It is assessment of children's social emotional functioning, their intelligence level, their academics. We do a complete social history with parents. We look at the medical history and a number of cognitive tests that we look at the ways that they learn. For students presenting with social emotional problems, it's more intensive looking at that area.
Now, what are these all questions? Are they filling out forms if they can? How is this done?
The psychological evaluation is conducted one-on-one with the student. They may be asked questions, they may be asked to do things with blocks, hands-on activities. We assess their reading, writing, and mathematics skills. Questionnaires are state-of-the-art in terms of looking at social emotional functioning. Parents complete them for us. Caregivers, teachers, even the student can complete one.
So that everyone is involved. The parents are
Everyone.
taking the steps, because sometimes parents feel left out, they don't understand, and but they're with you all the way.
Absolutely, and we really cannot know a child without the parents' input fully.
And with your screening and what do you do after the screening? Is it the same type
We
of thing?
offer clinical assessment to our parents, and the engagement rate is 98% of our families engage in services. We give them choice as to which clinician they would like an assessment with. We have bios on our clinicians as well as our navigators, and we really believe in families' right to choose who they work with. The assessment meets with the family and the child, and the clinician also sometimes gets information from the school. If there was an IEP on the child, we'll request
The
that.
IEP is the
Individual education plan, and that's an important tool for the assessor to take a look at. So it's a more global assessment that they do. They also sometimes, if a child's been to a neurologist, will get those medical records from the pediatrician sometimes. So it's a global assessment.
It's like if the child has diabetes, you're getting all the
pieces
together. And I had a question in my mind, and then I talked about diabetes, and I'm off the question. But if they don't have, your program is free.
Yes.
The schools is free.
Absolutely, yes.
So, and there are private practitioners who will give services, so that there's no question, if you don't have money, you can get services. What about language difficulties? How do you deal with that, where someone may speak English but doesn't quite understand English or doesn't speak English?
We provide interpreters for our parents who speak other languages. That's a standard part of what we do. If they need help completing any of those forms, we have someone to assist them with the forms.
Okay.
So.
And you do the same?
And our screenings are in English and Spanish, and most of our HUGS team is bilingual English and Spanish.
What about Creole?
We have some forms in Creole. We've had some staff to help with Creole-speaking families. At the moment, we don't have someone on staff.
But you'll get some, because Collier County, I find, it's not just Spanish, English. It is German, French, whatever. But you do try so that everyone does get legally. What are the parents, if they need this assistance, is there something legally that they are entitled to?
All children are entitled to free, appropriate public education legally. So we inform them of their rights anytime that we're going to do assessments with their children or any kind of interventions that may involve accommodations such as Section 504. Parents are informed of their rights.
And that they should know this. Now also, I just want to bring some of these things up, that they can bring someone with them for an IEP program, and so that there should be no reason if they speak out. And does this hold true with the HUGS program too, that the parents are there?
Yes, and the HUGS team also sometimes accompanies the parents to an IEP meeting to help support the parents as well as the school to know what services that they're getting outside of school.
And now as we're coming down towards the end, I just wanted to, we've talked HUGS, we've talked the schools, and Van, could you just re-emphasize how there is a community component? It's not just one person or two people doing this.
Well, again, with our problem-solving teams and the parents' involvement, we can assess the interventions that are needed. We provide a list of resources to the parents. School psychologists, school counselors, people at school work very closely with the agency that's going to be providing services in addition to what we're doing.
And last word, one sentence, what would your advice be for parents?
To get help.
Don't wait a second. Call us or call somebody that is able to provide mental health services.
And that's, I think, the message at the beginning. It's nobody's fault. The fault lies in not getting help. So please, you'll see at the end of the broadcast, or you'll get contacts, but you can call Naples Alliance for Children, 649-5260, to either get our directory or get some names. And thank you for being with us, looking at children's mental health, and we'll see you next time.
Thank you for watching the Naples Alliance for Children, presented by the Education Channel. If you have questions or comments for the show, please call 649-5260 or visit napleschild.org.